and reestablish another Zoom meet, address for parliamentarians and of course the members of the clerk, the supporting staff. And for the rest of persons, and I see there are about 70 odd persons online, I'm going to ask you to just follow the instructions and observe directly from the PBC, sorry, PBC that we will post. So I apologize for those who have come on to rectify. It can get a little confusing with so many persons online, especially if you don't follow the instructions of the mic muting and so on. All right, so sorry about that. And you have the address now? Send me the address. Let me just give you the address so that you are okay, so PBCJ television floor 113 or Digicel play 114, PBCJ YouTube channel, which is www.youtube.com user/PBCJamaica, or their Facebook page, www.facebook.com/PBCJamaica/. So you can go PBC Flow 113, channel 113, Digicel Play 114, YouTube, www.youtube.com/user./PBCJamaica, or PBC Facebook page, www.facebook.com/PBCJamaica/. Thank you very much. And we will now have to tune out and start another.
I'm so lonely. You're not afraid of the dark, are you? Don't be afraid. Come with me.
Please, no. Oh my God, please, no.
The corrupt are getting away too often. Help catch them now. Jamaicans must call 1-800-CORRUPT.
Yes!
Enforce the law. One law for all. If convicted and found guilty, lock them up. It's our money that's being wasted. Lock them up. Stop the corruption. Build integrity. A message from National Integrity Action.
In Jamaica, there needs to be one law for all. Every member of this society, regardless of profession, finances, or the area you live in.
I have some bad news.
The company didn't get the contract?
The money they paid us for it has gotten out.
Are you serious?
I'm afraid so. And I understand that there are going to be corruption charges.
Minister, please come with us, sir.
Breaking news. A senior politician and senior civil servant have been charged for corruption.
Thank God not all of them stay, sir.
Build integrity. One law for all.
A message from NIA.
We feel invincible because we're young, but
COVID-19 doesn't care about age. Anyone can contract COVID-19. Take preventative measures to protect yourself and others. Cover coughs and sneezes. Wash hands frequently with soap and water or an alcohol-based hand sanitizer. Practice social distancing. Stay home if you are sick. Clean and disinfect areas touched frequently. If you are sick, call 888-1-LOVE or 888-663-5683. For additional support, call 888-NEW-LIFE or 888-639-5433.
Coronavirus is in Jamaica, and I know you feel scared and worried. But you can't let COVID-19 divide us. Coronavirus infects all kinds of people. It doesn't discriminate. So why should you? When someone coughs or sneezes or shows signs of the virus, tell them to call 888-1-LOVE immediately. And remember, stay 3 feet away, but don't attack or disrespect them, because we're all in this thing together. Come on, Jamaica. Cut the hate and don't discriminate. Let us stand together and fight COVID-19 as one family, one nation.
It's a new day. Our responsibility to protect our children from harmful TV and radio content.
A and X are no-nos. PG is maybe. G is good to go.
Protect your children and report offensive broadcast content. A message from the Broadcasting Commission.
Make it a new day, yeah.
What happened, Tristan?
Mommy, what is an activist?
Activist? Where you hear that word?
A lady was on the TV and she said she is a children's activist.
Oh, the advocate.
That's what I said.
Okay. The children's advocate is the person who makes sure that people know and respect the rights of children. She also makes sure that they are protected. She makes sure that even the government does its job properly when it comes to kids.
Children have rights too, Mommy?
Of course.
So, Mommy, do I have the rights to a little ice cream?
Right now, you have the right to go to bed.
Be an advocate for children's rights. An invitation from the Office of the Children's Advocate.
If you discover a large fire within a building, sound the alarm, leave the building immediately. Proceed to the assembly point. Ensure that the fire department is called and report to the person in charge of roll call. And don't return to the building unless instructed. Educate yourself.
The good news is you can protect yourself and your family against the coronavirus called COVID-19. The doctors and other experts say that the virus can be spread from droplets you expel when you sneeze or cough. When you sneeze, use a tissue, then throw the tissue into the garbage. Then wash your hands with soap and water. If you don't have tissues, you can sneeze into the central part of your elbow, just like this. That way, the germs are away from your hands. Protect yourself and your parents from the coronavirus or COVID-19.
Reduce your risk of viral illnesses like the flu and coronavirus. Wash your hands frequently with soap and water. Cover your nose and mouth when coughing with a tissue and dispose of it. Avoid close contact with anyone with a cold or flu-like symptoms. If you become ill, please visit your doctor or the nearest health center and share your travel history. The flu and coronavirus can kill. Let's protect each other. A message from the Ministry of Health and Wellness.
No one is immune to mental illness. Your age, race, gender, social class, or economic status is no match for addictive behaviors, anxiety or eating disorders, depression or schizophrenia. What is having a good social support system. As the saying goes, in times of test, family is best. Unfortunately, many are denied the benefit of the support of family and friends because of stigma and an oppressive silence around mental illness. Let's put an end to the silence.
Speak up. Speak now.
End the stigma.
Share your story.
End the stigma.
A message from the Ministry of Health and Wellness.
Yo, the scammer them a call people number foreign. But when you mix up with them thing there, your number can get called. Or your family. Stop the thieving. Stop the scamming.
Call Mocha at 1-800-CORRUPT.
Nah, click on your link for my liquor brother pre that slot bro, we no need that. And the next thing them type a song they are listening online, what kind of thing that some big man pose up on them profile and I put chat to a small child. Watch yourself.
To keep under review developments relating to the present public health crisis arising from the spread of the SARS COVID-19 for the leader who is here, do a quick overview as to what the current state of play is, and then wanted to spend a little time on testing because I know that's a concern, and we had asked, I'm going to ask the Chief Medical Officer to speak a little about the testing. We were in Parliament, as you know, yesterday, Member Guy and others, and testing came up quite prominently. And I've asked also Professor Bain, is he online? Professor Bain online? We'll check on that. Just ask Nicole to find out if he was invited back on the new. We'll ask Professor Bain, who is also going to be in the meeting with the Chief Medical Officer, who is a member of a committee that, an advisory body that was set up by me to discuss the issue of testing. He's into infection control and all the other things related to matters of this kind. And so I've asked him to be online to share in some of the views on testing and any questions that the committee members may have. All right. So can we just go into the matters arising quickly? For those of you who have the minutes, I'm assuming all would have access to. Can we go with page 2. Page 3.
Chairman.
Yes.
It's technically a minor point, but it's something that we need to look at. It's the style of the meeting, because there is a lot of use of posited and opined coming from the CMO and yourself as to what happened. I think in terms of housekeeping, there are definitive statements that are made by the CMO and yourself. So it can't be that one opined on a particular thing or posited a particular thing, because there is a little difference in terms of the meaning for the word. You know, so it's just something that the clerk will have to look at.
Okay, so Clark is online and listening, so she'll note that concern that is there. All right, if there are any specific areas that you think may result in a misinterpretation of what was said, happily we will we'll correct those, or you just raise those and we'll correct. All right, the page 4. Page 5, page 6, pages 7, Pages 8. Nine, page 10, 11, 12, 13, 14, and finally page 15. Are there any corrections? Any corrections? No corrections? Okay, can I ask for the minutes to be confirmed? Any confirmer of the minutes?
So moved, Chairman.
So moved by member Guy, seconded by anyone? Member Burke, Brown Burke. All right, thank you. I volunteered you, but you have agreed. Thanks a lot. All right, so matters arising from the minutes, just bearing in mind, members, that the CMO will give an overview as to what is happening or what has happened over the last few days. So if you want to hold some of those issues, but if you have any matter that you think requires immediate intervention from the minutes, please go ahead.
It's not a matter from the minutes, but it's a matter that I'd like to bring to the fore before we start the meeting.
Sure.
We are a committee of the Parliament of the country, and I just want to bring an issue that I think that needs to be ventilated here before we start the meeting. Our being on this particular committee is a sign of our cooperation as mandated by the Parliament to work opposition and government for a whole country approach to this. And I, on behalf of my members, we take some serious exception to the Prime Minister's suggestion yesterday, and that the members of the opposition were, for want of a better word right now, but hitting at the technocrats in the ministry, and that we are not supportive of the fact that they are doing their job and we should not basically harass them. My choice of word as well. I want to make it absolutely clear that we are in support of the health workers, but we are in support of the technocrats in the ministry. But I also want to say at the outset that support does not mean that we are going to kowtow to everything that is said, because there are differences in terms of how even medical doctors operate and their views on certain issues. And if we object or make recommendations contrary to what the technocrats do make, I think it is only proper and fair that as committee members and even professionals that it is respected. I don't think that anyone in their right mind, and certainly we all are in our right minds, that we would attack the health advisory or the advice that you get. But there are times when we will disagree with them. And I want to place on the record that it's a disagreement we have sometimes with some of the policies that give rise to the fact that we will make different recommendations and alternate recommendations. So I just want us to reject that particular notion that we are there. And secondly, that we, as part of the spirit of cooperation, will continue to be part of it, but at the same time, we will make alternate recommendations. Thank you.
Thank you, member. I missed that comment because I had to leave for an engagement re-COVID. I'm sure that there was no malintent on the part of the Prime Minister, but I hear you and I've taken note, and I'll certainly raise it in other quarters, just to be absolutely clear around the issue and that the concerns that you have raised. All right, thank you very much, member. Are there any other matter that are directly arising out of the minutes? If not, yes, member Plumber.
Sorry.
The two quick issues, Mr. Chairman. The first related really just to the issue I had raised about the collection of path benefits, and because we have seen that happen since then, I'm extremely concerned about what happens when individuals go to collect path benefits. This now is an activity that is being done by the state, agencies of the state, and I believe that we have to do a little bit more in terms of protecting individuals when they go there. I know that persons are going to say that each individual, we have said it often enough in terms of physical distancing, and persons should be responsible in terms of how they line up to collect it. It's not happening, and I'm extremely concerned about that. And I want to ask that the agencies, whenever government is involved, that at the very least we lead by example, so that we put things in place to ensure that persons are in fact observing the precautions that we have set. So that's one. I have a second point.
Okay, from Amanda, right, from the minutes. The second point related to Amanda.
Well, no, when we're finished, I'm going to start before the CMO gives her a presentation. I'd like to say something.
Well, she's about to do it. If there are no other issues.
Another matter, Minister, she may give it in this presentation, but it has to do with the numbers of ventilators that are here now. Page 5.
Right. Yes, go ahead. Page 5, what paragraph?
The third paragraph. 30 ventilators were ordered by the NHF, which was a part of the ministry's plan of acquiring 40. 6 were received as at the date of the meeting. 7 will receive at a further date, and remaining of the 30 ventilators are expected at the beginning of May. Where are we now in respect of that?
Okay, Timo, you want to take that on?
Right. So we are at the same place, not a guy, because we have not been advised by NHF yet that they have received the 7 that they said we would receive by the end of this week. We have not received that 7 as yet, or we have not gotten the notification of that. So we still would only have received we had gotten a little bit more from ProMac, because it was 29 in all that we had gotten from ProMac. And we had in our numbers 23. So those are in fact in Ireland and are being distributed to the hospitals. And we had the 6 that we have gotten so far out of NHF's order. And those 6 are also being distributed to the hospitals. So really, so far we would be at 29 plus 6, 35. But of the 40 that our initial projection for NHF to buy, we have only gotten those 6 of those.
Minister, are any of those 6 related to the information you gave us in the Parliament about our inability to get certain medical supplies out of the US?
You mean the ones that are waiting to come in, or the ones that we?
The ones that the CMO just said that she has not been
I don't
advised.
I don't have information on ventilators. I had given information on reagents for testing, and I was given information on PPEs, N95 mask in particular. I could check on the ventilators, but I have no information that's one of the issues.
But Minister, as something as serious as this, and having regard to the fact that other territories' ventilator supply has been restricted, a red flag ought to have gone up to say whether the 6 also that we are, or the others we are waiting on, are part of this embargo, for want of a better word.
I'm assuming that, given that it wasn't brought to my attention, then it's probably not part of that issue. I trust the technocrats to advise me if there is an issue, but I'll check just to be abundantly sure. All right, thank you very much. Madam colleague Brownberg, you wanted to make a point just prior to the CMO coming in.
I did. And it relates to the discussion that we were having yesterday in Parliament in terms of the opposition's position as it relates to testing and the position of yourself and the Ministry of Health. And I didn't like what might have been interpreted from the statements and the discussions yesterday, so I just wanted to make it clear. Well, when I listen and look at what has been happening, what is clear to me is that we have been asking for a more aggressive and more expansive protocol for testing. as we have come to know now, the Ministry of Health, they have been changing the protocol as they have thought fit. And so what has happened now is that a number of the things that we would have been asking for then are now included. The truth is that I believe that it is just a matter of timing, that the opposition would have wanted to see some of those things started earlier. I did not like the inference that it might have been out of panic while we were saying that. And I did not like the inference that we wanted to share in making sure that this is where we are. I just think that we need to accept it for what it is, that we have been asking for a more aggressive approach to testing. And a lot of countries are following the WHO, but they're not all doing the same thing. And in the same manner of which Dr. Guy spoke earlier, I just believe that our comments and our contribution to that discussion needs to be taken in that light.
Point noted, Member Brown Burke, and we will discuss as we are so inclined about more on testing in short order. So can I just ask the CMO to just quickly give an update, and then you can branch off a little into the testing. I think Professor Bain is online or should be online shortly, and I may ask him to give us a few minutes also, and then we can open it for discussion. CMO.
Okay, morning everyone. In terms of the update, so we have 143 confirmed cases now. These are 33 imported cases. 37 are contacts of a confirmed case. And we have treated the situation at Alarica separately. We have 52 confirmed cases out of Alarica. As you may be aware, that investigation started out of a case that presented to a general practitioner, and it was our contact tracing that took us to Alarica, and then we started the investigation there. So in terms of this, to actually say who was the index case in that situation, even though we had a first present case, we are still having ongoing investigations to find out if there are any kind of contacts with imported cases or contacts with confirmed cases from any of the persons that are presently at Alarica. So we have 52 cases there. They represent a cluster that is there now. So those cases are under investigation. So the distribution, now what has happened now, because we have this cluster of cases, is that it changes the demographics, because previously our demographics were very similar to what we would have seen in other countries. But now that we have a cluster that is in a specific community, let's call it that, a specific, what should I call that? Well, let's call it a community of workers who themselves have their own particular demographics, being that they're of the younger population. And in that kind of setting, we tend to have more females than males. You will find now that our overall demographics have shifted. And in some of our reporting going forward, you may notice that we may separate how we report, giving an overall picture, and then also giving a picture of what is represented by this very this group that has its own characteristics. So overall, you will see now that we have 56 males and 87 females, which represents a shift. And now our age range is 2 to 87 years. In terms of testing, so far, up to the 15th, we had tested 1,424 samples, of which we have 143 positive, as we said, and the rest are negative. In terms of distribution, geographic distribution, most of our cases now lie in St. Catherine. coming out of the Alarica incident. And then our next most populous area, Kingston and St. Andrew. So we have 58 in St. Catherine, 25 in St. Andrew, and then we have 17 in Clarendon, 12 in Manchester, 8 in St. James, 6 in Portland, 5 in St. Elizabeth, 2 in both Westmoreland and St. Mary, and 1 in Trelawney. In terms of the updates of the numbers, that's where we are.
Okay.
Not sure if you want.
Thank you, CMO. I don't know if we want to start a discussion or just allow her to speak about the testing. Yesterday, I spent some time in the Parliament going through the testing methodology. And maybe I would like her to just give us the approach to testing. And then I know Professor Bain is online. If he wants to, well, I'd like him to speak for 5 minutes or so on the same issue. And then we have a conversation.
Just on a matter of clarity, Chairman.
Sure, go ahead. Member.
I just wanted to ask, I noted specifically when you gave the numbers a while ago, you spoke of 1,424 samples. Are you always quoting samples, or has some of the reports been around persons tested?
I'm sorry, those are 1,423 tests, 424 tests that were done.
We have many more samples.
So actually, these would be new cases, because we would have done a lot more tests than this, because we would have been doing the discharge testing, where, as I said, one person may have up to 5 tests being done. And then also each day we would be doing the confirmatory test from the previous day. So,
I just wanted some clarity, which means that you often are speaking about samples, because I believe that a lot of the population is really thinking about people.
Yes, so this is
cases and not samples.
Right. So this is,
and I know that in the reporting worldwide, there has been that kind of confusion as well. Well, not really confusion, discrepancy in terms of how the cases are reported.
Thank you.
Okay, Simo, you want to just comment on the testing methodology, and then we...
Okay, right. So I'm very, very sorry for the misunderstanding that happened in the second meeting of this committee, because actually the first meeting that I had attended, I did point out the sampling protocol. And at that time, the sampling protocol had, and that is the sampling protocol that we are using now. When we just started, we were only doing the suspected cases. I must say that at that time, we were collecting the samples from the contacts of the close contacts of the cases. However, because we were unsure of our ability, of our capacity in terms of testing, we were not running the samples at that time, but we had collected those samples. So the close contacts for the first index case, we had collected all the samples of the direct contacts when we put them into quarantine. And so when we put them in quarantine, we would have had a sample. And then when they were released from quarantine, we would also sample them as well. So we have been doing that, but we were not reporting on it, and it was not part of our protocol initially, but we thought it was prudent to collect the samples. When, however, because if you will recall, the initial kits that we were getting from PAHO had only 96 tests. So it was only after we got the kits that we had now 3,000 tests available that we went back and sampled some of those persons. But again, I would say that it was not part of our protocol. We just thought it was prudent to do it. We changed our protocol, and in the first in the first parliamentary committee meeting, I did report that we were testing the close contacts, whether or not they were symptomatic or asymptomatic. Unfortunately, in this second meeting, it was reported that we were not. And I think that caused some confusion. But I don't know if it was minuted, but we did have that presentation that went through the fact that we were testing suspected cases, close contacts of persons who were confirmed cases, and we had started the surveillance across the island, which was also not a part of our first protocol of testing, where we were testing the severe infections and the ILIs. At that time, we were only testing in the sentinel sites. So there would only, I believe, have been 7 hospitals that we were taking the SARI test from. And for the ILIs, I believe it was 72 health centers that are sentinel sites. So at that time, we had limited where we were getting the surveillance from. And that surveillance followed the routine surveillance that we carried out for influenza. Now, in addition to that, we had started to do the healthcare worker testing. But at that time, at the presentation in the first committee meeting, we were only doing the ILI testing for the healthcare workers. Now, since that, we have, and because I want to just emphasize that we are of the same like mind in terms of getting as much tests done on as many persons. However, we have the sampling protocol that indicates who are the persons that we are most likely to get positive cases from. And I think that is where we may differ a little bit, because we believe that the sampling protocol is adequate for us to have a feel of the entire population. However, we expanded the surveillance testing. And so instead of only limiting our surveillance testing to the hospitals and the health centers that were in the initial influenza protocol, we are now including all hospitals and all influenza and all health centers. So we have sent out the message to our healthcare providers to say, yes, we want everybody who comes in that has anything that looks like an influenza to be tested in your accident and emergency departments, in your health centers, and all your severe acute respiratory infections are to be tested. In addition to that, we have a lot of persons who are seen in hospital and are admitted or are sent home that are not classified as severe acute respiratory infections. And this would include some persons that person would have just labeled as lower respiratory tract infections, community acquired pneumonias, persons who would not meet the criteria of SARI, and they would be more than an ILI. So we have also included that set of persons to ensure that all of those persons are tested. So we have widened the sampling protocol significantly, and we have also, in terms of, we have sent out our healthcare worker assessment guideline. And in terms of the healthcare worker, initially we had presented that we were doing ILI testing for the healthcare workers. In sending out the healthcare worker assessment, we have identify that the healthcare workers must be categorized in terms of their exposure, in terms of low risk exposure or high risk exposure, and those persons, whether they are symptomatic or not, should be tested. So in addition to the influenza-like illnesses that we would test for the healthcare workers, we have broadened the testing for that as well. So yes, we are following the guidance in terms of what is out there from the WHO. I must say that we had adopted the testing of the contacts before it was put out by WHO, because at the time when we had mentioned it in that first parliamentary meeting, WHO still at this time does not have that as part of their sampling protocol. So we have expanded because we think that there is likely pickup from these persons. We do have a challenge in getting all the samples in. And we have been I've had discussion with the medical officers of health, and many of them have started to do that as well in terms of reaching out to the general practitioners, because we recognize that even though we are saying test everything that comes into the health center that looks remotely like an influenza-like illness or a flu-like illness, test anything that comes into the accident and emergency departments, that looks remotely like. We recognize that there's a decrease in the persons, which persons are rightly following the instructions to stay at home. So for the stay-at-home persons, some of them are visiting their GPs or are calling their GPs. We have now reached out to the medical officers of health, who have, through the network that had been formed with dengue, where we had established the WhatsApp groups and the email groups for the GPs to get information out to them. We have asked them to utilize that same method to get the GPs to indicate whenever they have persons who require testing, so that we can arrange for those persons to be tested. Now, I can say that for the Western region, based on the reports that we had last night, the Western region, I know, have actively started that process. And also the Northeast region reported yesterday that they have actively started that process. The other regions, we have encouraged again, and I know that some of them have started. And by this way, we expect that we will also increase our sampling.
Okay, thank you very much. Now I'm going to ask colleagues just to allow us a few more minutes to ask our special guest, who is sitting in with the CMO but remotely, Professor Brendan Bain, who is a trained internal medicine, infectious disease, and public health and medical education professor, with accolades that I would not go through, but it's multiple pages. Many of us would have heard of Professor Bain and his work in HIV, but he is a part of a small subgroup of specialists that I invited to form a little group that I consult with from time to time to support the staff here at the ministry, to give some advice, and in particular, focusing on testing. And I invited Professor Bain. He has graciously agreed to sit in on the meeting to help to clarify if any issues need clarification. But I'd like to just give him an opportunity to comment briefly on what we're doing and his own participation and his own assessment. Professor Bain, thank you.
Thank you, Minister, and good afternoon to everyone. Before I say anything, I just want to ask CMO to clarify again, based on Dr. Brownberg's question, what the ministry means by cases. 1,424 tests were done, and I heard you say these were new cases. Is that correct?
Right. What I mean is that we do a certain amount of repeat samples each day. Repeat samples so if we report that we have done 90 tests for today, we would actually have done maybe about 105 tests, because we would have additional tests who were repeats that were to confirm tests, and we would have also been doing our negative discharge testing. So we don't report those numbers because that individual would have been counted already in a test that was reported. That's what I would want to clarify.
Yeah, and by the use of the word cases, you're not saying that all of these persons were infected.
These persons they come from different groups, because we would have had our suspected cases who would have met the case definition. we would have had our the contacts, then we would have had our routine surveillance that would have been included in that group. So the SARIs, the ILIs, and the healthcare worker surveillance.
But the question he was asking is whether they by saying
So they would not all.
they're not infected.
They're not infected, and they are not all classified as suspected cases.
Okay, the reason I asked is because in the present group of persons, sometimes the word cases can come across in a way that could be misunderstood.
Yes, I understand what you're saying.
Thank you for that. So Professor Bain, over to you, sir.
Yes, thank you. I just need to establish for the committee's information that the testing that's been done so far is what is called PCR testing, and it detects viral material that's present within the core of the virus, and it indicates current viral infection, and so it's used as a diagnostic test. It's also helpful in contact tracing, because in contact tracing, you're really reaching out to persons who are suspected of having been in contact with an infected person. And you want to detect whether any of those have actually picked up the infection. As the discussion on testing has unfolded in many, many countries, there is a new discussion about antibody testing. And there's a lot of pressure on systems, national systems, to start doing antibody testing. The challenge with antibody testing is that you first have to identify in the lab a portion of the virus that is not shared by any other viruses. And everybody in the room probably knows by this that the novel coronavirus is one of a big family of coronaviruses. And so it has not been a straightforward matter for the labs to identify foolproof antibody tests. In my reading, and everybody is reading rapidly as things unfold, in my reading, I see that progress is being made and a lot of sorting is happening. But in Jamaica, we have to depend on the basic tests that are done elsewhere. We have to depend on the track record of different suppliers of tests. And I think that is going to be quite soon that antibody tests will be available. But it is important for us to understand the difference between the PCR tests that are being done now that are helping us with diagnosis and antibody testing, which can be used in contact tracing weeks or longer after suspected infection. But I don't want to go too quickly to weeks or longer. The basic information is that antibodies are the body's protein response to any kind of invader. And in the context of infection, antibodies begin to appear anytime from about a week. This is talking about novel coronavirus. Anytime from about a week after the infection is manifest. So I believe that not only here in Jamaica, but anywhere that these infections are being recognized, the PCR test is the one that is going to help us to recognize new infections. The antibody tests are going to be helpful as time goes on, but they turn positive about a week after the infection starts. So I'm going to stop there and pause in case anyone wants to ask a question.
All right, thank you, Professor Bain. All right, so ladies and gentlemen, colleagues, you would have heard the report from the CMO and Professor Bain's initial comments on the two types of tests. I am opening the floor now. I see Member Guy's hand up, and I'll recognize him. And then Member Brownberg, I don't see any other hand. So Member Guy?
You're not seeing my hand, Chair?
I'm seeing it now, Member Golin.
Okay.
Thank you very much, Chairman. Since you have Professor Bain on the line, I think I'll deal with his questions first before I ask some other questions of the CMO. Prof, you indicated about the antibody testing, and you recognize too that we have to learn from other people's testing of those particular tests to determine whether it is to be utilized. In the United States, we have learned, and yes, we have been doing a lot of reading and fast reading too, that Selex has one of those tests that does both IgM and IgG antibodies. Now, we know that there are many persons who are asymptomatic who have the virus. So in terms of the testing, and certainly as the minister had indicated yesterday, we will get there. The fact is that we need to have an idea, even if it's the early stage of the disease. You said 5 days, or was it 7, whichever day it is, but you'll start to see IgM antibodies earlier than the IgG, but they still be in the stage where they have the condition. Now, wouldn't that be important to know so that we would have an idea as to those who are in contact in that particular environment to do the definitive testing then, which is the PCR, as you have indicated?
I believe that the PCR test is the one that should be done to be able to allow us to detect an infection, whether symptomatic or asymptomatic, at an earlier stage. It may be that a reliable antibody test could be used as a kind of supplement, but I think that at the present stage of our knowledge and development, I think that we will find that we'll be able to transition, but I'm not convinced that transitioning at the moment in Jamaica is going to take us further forward in our knowledge of what's happening.
Could you explain what you mean by transitioning?
Okay, the labs that are working on testing are two: the National Influenza Center at university and the National Public Health Lab, which I'm told is going to be able to start doing testing either before the end of this week or by early next week. Now, the persons in these labs are keeping in touch with the literature. They are sorting, just like a lot of other people. In fact, some people who are not lab specialists are also doing sorting. The pharmaceutical reps, as I understand, and you'll have to check this out, because I understand that they are actually sending kits, not to the government, but outside, and this is risky. And that's a side comment. But the labs are trying to decide when it will be valid to begin implementing antibody tests along with PCR. And the transitioning that I'm talking about is that transitioning. I don't think that PCR will stop being done, but it is possible not long from now that some rapid tests using antibodies will be done as well.
Okay, can I move on then to Member Brownberg? Thank you, Professor Bain.
Okay, thanks very much. Just a couple of questions just for clarity. In terms of the GPs and others, right now, they would send samples to the two national labs, yes, to be tested. Is that what I'm hearing?
No, the GPs are not themselves testing.
Right.
if it is, what we have asked the medical officers to have discussions with them. If they wish to test, then we will arrange for collection of the samples. Many of them, however, do not want to test, but would want their patients to be tested. So the arrangement more is for us to be able to test the patients, whether they would come to the facilities that we have designated, or, as I've said to some of them, if there's a large general practice where they have a significant amount, then maybe we should go to them. So,
Okay, that's understood. The other thing that I was kind of wondering about, because yes, we have now changed the protocol, but what I heard earlier was an acknowledgement that there are in fact a number of individuals who had been obeying the precautionary measures of staying at home and self-isolating. Back then, if they did not show certain symptoms or got to a certain stage, they would not have been considered for testing. I'm asking therefore, could we have missed individuals who had been self-isolating and so on, who were never tested because they weren't part of the sampling protocol, who actually had COVID-19, recovered, and are out? And I'm just simply asking in terms of, I remember the CMO saying that based on the testing protocol, we have a very good idea as to what it looks like in the population. And I'm just asking if we could have missed some of those in the individuals who were actually staying home.
for sure, Mrs. Brownberg, that they're always, whatever we see always represents a sample. Okay, and we're not going to have definitive numbers. However, what we know and is that the sampling protocol is designed to pick up from the areas that we're more likely to get a yield from. And any sampling outside of that, random sampling, is really not going to give us any additional information that is going to lead to a major intervention. Because the sampling protocol is so designed that in terms of picking up the contacts, in terms of doing the general surveillance, that general network across the island, it really is spread very widely and it is designed to be able to pick up and to detect early what is happening in the island. But I can tell you that yes, you are going to have those few persons that may remain undetected under the radar that would be out there. And we really can't avoid that no matter what sampling protocol you use.
Okay. So my final question, and this is my final question, Minister, is just, and it goes not to the testing, but rather to the reporting. And I was just wondering, just for ease of the public's understanding, whether or not the reporting can be done so we can follow the number of individuals as distinct from the number of samples that are tested.
Okay.
Okay, thank you very much. Member Golding, your question, please.
Thank you, Minister, Chairman. I have two questions for the CMO. Firstly, in relation to the Alarica employees, we were told that there were 787 staff members at Alarica. I don't know if that was just the Portmore outlet or it included the Kingston outlet, but we were told the number 787. Perhaps you could clarify if that is Portmore alone.
That's Portmore.
Okay, at Portmore. We were told on Tuesday that 258 had been interviewed and samples were taken. And we got 65 test results back, of which 33 were positive. So the positive ratio is roughly nearly 50%, or a little, just over 50% of the test results that came back. What I'm asking is, have all of the Alarica employees, has samples been taken from all of them? If not, how many of them have samples been taken from? And secondly, of those samples that have been taken, how many test results have come back from the Alarica employees? And thirdly, well, I believe the positive results we were told was 60 something, 60.
52.
52, thank you, 52. So I was asking, that 52 is derived from how many test results that have actually come back of the Alarica employee group, and how many samples were taken from them. In other words, how many employees had given samples to the health authorities. That's the first issue. And I have one other issue after, Chair, but that's the first.
Or well, you're gonna leave it.
Okay. So while we're waiting on this second issue, first of all, I just want to say that the 52 that are tested positive would include both the employees and their direct contacts. So it would not necessarily be 52 employees. I don't have the difference to tell you how much were directs, were employees and how many were contacts right now. But it was out of the investigation for the Alarica case. And for St. Catherine, we have tested 414 of the employees. We have a list of 559 that belong to St. Catherine. And we have tested 64 contacts for those persons so far. For Clarendon, we have tested 11 employees, and we have tested 10 of their contacts so far. So in all, that would take us, for employees, we would have tested 414 plus 11, and for contacts, we would have tested 74 contacts so far. And the testing goes on because we're really hoping to try to wrap up at least to get all the employees. I must say that we do have some challenges because the addresses that were given, we only got addresses from the place of employment, and the addresses that we only got 695 addresses, and we had an issue where 112 of the addresses that we got, we could not find those locations. So we do have some contact issues there, but we're working at it. We're working with the team leaders to get the telephone numbers and to try to contact more each day. So yesterday we tested over 200 persons, and we are trying to, as I said, to rapidly proceed with the testing to get all persons tested as quickly as possible.
So,
Minister, before Marcus, may I just ask for an intervention here? CMO, could you therefore, because there's this controversy, and Dr. Brownberg asked about it earlier in terms of numbers of samples and numbers of persons tested. Can you therefore indicate to us how many samples are out there that have not been tested? And it would clear up a lot of the challenges we're having now, because we recognize too that you cannot test as you immediately sample. So can you give us an idea? Because the question will come back at the Alarica group that you indicated Tuesday, that we did 258 samples. 65 were tested at a time with 33 positives. Yesterday, we did 1,391 tests of 101 with 8 results pending. So the question that people have been asking is that what has happened to the 258? Minister was asked that in the parliament yesterday, and he could not give an answer. He would have to check. Now, we would like to know how many samples are out there that are awaiting testing. Simple.
Okay, based on the number of samples that came in yesterday, at yesterday evening, we had 320 samples, I believe. I mean, that was about the number that at the end of yesterday were to be tested. Recognizing that we would not be able to test all of those within the 2 to 3 day period, what we did was arrange, because we would test just above 100 today at NIC. We also made arrangement to send 125 to CARFA, and they are being done today as well at CARFA, so that we would expedite getting the results. So those have been taken to CARFA, and we will get those results by tomorrow as well. So that was in order to prevent us having to wait 100 and odd, then 100 and odd, because of this large amount that came in on the one day.
Hear me, PS. Minister, aren't we our flights between Trinidad and Jamaica suspended?
The JDF took them across.
Thank
you. Remember, 1 second, member Golden. Remember, I said in the parliament yesterday that we are going to bolster the daily tests by activating the National Public Health Lab, and that the equipment should be activated by Friday, I believe, right? Was it Friday? I was told Friday. So we will be in a position to do all of that. But again, given the situation with the call center, the fact that this is, I mean, nobody expected a scenario such as this, even though we are preparing for it, just in case it happens. We wanted to move speedily to just deal with those tests. But I think once we get National Public Health Lab up and running, we should be in a good state to deal with eventualities of this kind. Yes, Member Golden, you are going to ask.
Yeah, just clarification of one issue before I go to the second one. Just the 425 tests, 414 in St. Catherine, 11 in Clarendon. I think you said, is that right?
Yes.
21 in Clarendon.
21 in Clarendon. Okay. 21 in Clarendon. So it's 435. 435. Yeah. Have you got the results from all of those already? Or in other words, is that saying that of the 431, is it 435 tests that have been done of these Alarica employees and their contacts? And is it the 52 positives that have come back from those tests, or are we awaiting the results of some of those tests still?
400 and odd samples collected, but not all the samples have been tested.
Right.
Well, please clarify that, CMO.
Yes, as I said, we had 205 samples coming in yesterday, and so we do have at the end of yesterday we had about 320 samples that need to be tested. The vast majority of those are going to be coming from the Alarica group. So unfortunately, I don't have the number of negatives, which is what you're asking for, because you have the number of positives, and you really want to know how many negatives there are.
Correct.
And I don't have that number.
Really, essentially, I want to know how many have you got the test results for, which would be the positive plus the negatives.
Which would be the positive plus
you don't have that. You don't have that. All right.
I don't have that number, but we can find that out at some point, Minister.
Right.
And
the other issue, Minister, if I may.
Sure.
Arising out of this call center situation and the response of locking down St. Catherine, many persons, I've heard you say you don't know the extent of this, but many persons have left the parish in response to the announcement and came into other parts, like the corporate area and maybe other parts of the country as well. This is causing consternation on the ground, where persons are aware that there are people coming into their neighborhoods from St. Catherine, say, or they may be call center workers and so on, who live there, and this thing has happened in relation to that call center. The question I'm asking is, what is the protocol in relation to that? Because I have people as a member of parliament contacting me. They're very anxious about this. What is the health protocol in relation to persons who may have left St. Catherine, having heard about this lockdown, come into another part, let us say the corporate area, and they're in the community. Are these people to be tested? Are they to be quarantined? What is the health authority? Do the health authorities want to hear about them? What is the position?
So right now, remember, the instructions that have been made public relates to the Ulrika BPO facility, the employees of that facility, and their immediate contact, their family members, based on the contact tracing.
And that's the Portmore facility.
That's the Portmore facility. So we have, as has been said, been mobilizing in the field to test. That's the 400 and odd so far. To follow up with interviews to determine who else should be tested. And we have done, I think, 100 plus contacts with persons who are linked to the employees, and that is an ongoing exercise. That is happening in 3 parishes. It's happening in St. Catherine, but also to a lesser extent in Clarendon, and also in the KSA area. So they are the ones that we really want to speak with and test. We're committed to that. Other persons who, for whatever reason, may have decided to leave St. Catherine when the announcement was made and gone elsewhere. The advisories that have been put out for the entire country would apply to them. Certainly in terms of the social distancing, the limitations on congregating, the curfew hours, all the other advisory would be standard procedure for those persons. If they are an employee, however, of the BPO facility, then they should report, and we have given out the numbers for them to call. And it doesn't matter where they are, we want to talk to them. We want to interrogate them, to interview them, to test them. So whichever parish they're in. So in a way, in a sense, if persons moved out of the area prior to the lockdown, you really can't force them if they're with their relatives or even friends. What you do though is give them the messaging that applies to all concerned and hope that they will comply with that. If they disobey, then clearly they'll be subject to the same sanctions as anybody else. We will continue to monitor the situation. It's a very fluid situation. And if there is a need for other actions related to the assessment, then those actions will be taken and made public. And that to my mind is what we can do at this point in time.
Yeah. So just in a nutshell, the fact that they may have come from St. Catherine into the corporate area or wherever, that doesn't sort of make them a person of interest from a health perspective. They're just expected to comply with the general rules that apply to everyone, social distancing, etc. If they were a contact of a call center employee, then you are interested. And you would like to have those persons, presumably quarantined and tested. What would you want?
Certainly an interview and samples collected, because that's what we're doing to all of those individuals.
Thank you.
Thank you. Are there any other?
I still have a hand up, Minister.
Oh yes, go ahead, member.
Yes. I am picking up on the last point that Member Golding left off on. Do you foresee a position or a situation, Minister, where these 100 persons whose addresses the CMO indicated are either bogus or not found, that in the public interest, you may have to ask them by naming them publicly to come forth if they don't, so that we can be tested? That's one. Two, Minister, there is a lot of concern in the BPO sector, especially in the eastern part of the island, Kingston, St. Andrew, and certainly in St. Catherine, which you have, basically all of them have closed. Are there any plans to close any other BPO center? And I ask this against the background that right next door to you, there's a BPO center, right where you are right now. Are there any plans to close that particular center or any other center in Kingston based on the connections with employees of Alarica or any other site which have closed is a consequence of a possible case.
Okay, so in regards to the first question about the persons that we are not yet able to locate, we will examine and escalate additional measures if those measures are required, because it is important that we locate all of those employees. And so we have started with working with management to get the names and addresses and telephone numbers. We have made contact with most, and many have come in, have gotten the test done, and we continue to follow up on that. To the extent that there are gaps between what we need and what we get, then it could mean or would mean additional measures would have to be taken. And those measures could be extreme. And I hear your suggestion, which could include that. But we want to try and keep it at a particular level and graduate it into additional measures depending on the response. On the issue of the other BPO facilities, we had a press briefing just prior to this meeting, and I indicated that some 68 BPOs island-wide, 62 inspections were done between March 14th and April 15th. 50 of the 62 passed the inspection. The others were given guidelines as to things to do. And those guidelines have since been stepped up based on this particular incident in Portmore. And the inspections are ongoing. The response to whether to close or not would be a function of what is happening in those entities. Because as I said to you, there are some entities that are really complying. There are many persons working from home who would have had no issues as it relates to social distancing and so on. 10,000 persons actually. We wouldn't want to penalize them because others are deviants and are not complying. So it really is a function of the audit, and we are prepared to close entities if they are not complying. The public health is prepared to recommend closure, just as they would for a restaurant that is not complying with food standards or health standards. So the answer to your question is yes, we would be prepared to, but I have no information currently of any that is to be recommended to close. You would have heard that one had voluntarily closed recently because of a link to a suspected or a case, and that I think is a responsible thing to do. We will continue to be vigilant and will take decisions based on a case-by-case basis, unless there is a widespread challenge, in which case the cabinet would consider it and make a decision.
And certainly, Minister, you're from the area what's a pass, look after and pick the fuss. So you look next door if there was something there to basically affect your ministry.
Well, there are 3 floors in my building that have BPO operations, and I see the workers from time to time. And yes, they certainly would be part of the entities that are inspected. I wouldn't want to put any of them in harm's way, nor would I want my own staff to be at risk. So we will take whatever actions are necessary, but it has to be objectively done based on an assessment. I see Member Dunn online. You have a question, Member Dunn?
Well, Minister, before Member Dunn, just a quick clarification on that last point. Was the Portmore Alarica outlet, branch, or whatever it is, facility, was it inspected by the public health inspectors, and did it pass muster?
Yes, Portmore was inspected. I spoke to that in the Parliament yesterday. There were a number of things that in the assessment that were satisfactory. There were some recommendations about doing some additional things, but generally speaking, they had a passing grade in terms of the operation at the time. Obviously, subsequent to that, there have been some issues.
Right.
The CMO wants to say something on that.
Right. I just want to say that as things emerge, we respond to some of those things. So initially, we would have had one audit, one type of audit report that we would have used for these facilities. where we would have been looking out for certain things in terms of their approval to say that they had met guidelines. And those were general, going back from before COVID, which included infection prevention and control measures. Subsequent to that, we sent out the workplace guidelines that now spoke, and this went out in March, early March, that we spoke about the general measures that now needed to be enhanced in light of COVID. We recognize now what has happened with this BPO. So the audits that would have been done up to now would have been based on those two guidelines. The initial guideline as well as the workplace guideline. We recognize that the BPO Association has put out a guideline that is a lot more specific, and we have looked at that, and we are adopting quite a bit of that in putting out a more stringent guideline for them to follow in terms of because we recognize that not every BPO is a member of the association. And so we are now in the process of finalizing, and by the end of today, we would have finalized that new updated guideline, sent it out to them, and then have the public health inspections done based on that new guideline.
Thank you very much, Member. Member Dunn?
Yes, Chairman. Good morning. Good afternoon, everyone. Question and a comment. In light of the fact that the over 100 persons are not being able to be found, as the new instruction gone out to the BPO industry and to some lesser extent with the supermarkets or distribution points where a large number of persons are employed to update their employment record to ensure that that forms a part of the protocol that they are issued. So that's one. And the comment is on two. For large places again like BPO that has hundreds of persons there, would the ministry consider having a public health warden stationed there permanently, and not just allow the establishment to do and to follow their protocol, but somebody from outside is stationed there permanently to check, to ensure that the protocols are being followed on a day-to-day basis?
Like a customs officer at a bonded warehouse.
That's right.
Yes.
Okay. On the issue of the communication, addresses and so on, I mean, the conversation is ongoing with the BPO operators. We have had some discussions since the recent events. The Prime Minister and I actually participated in a Zoom meeting with the association involving several members. And you would have heard the new announcements made. Public health workers have been asked to repeat audits and so on. So yes, that is taking place and new measures are being introduced. On the issue of the warden suggestion, it's not something that we have thought about. The staff is stretched right now. We would have to probably find additional staff to take on that responsibility. But I'll raise it internally with the team and hear what. The challenge with that, of course, is that if you do it for BPO, what is to stop the request from not doing it for markets and for supermarkets and for all the other places? I think ultimately the responsibility of these entities to operate in a particular manner should be influenced, one, by their own moral compass around what is the right thing to do, but also by the rules that are put in place with the threat of negative or positive stimulus. I mean, in terms of the penalties or otherwise. So what we need to do is really step up the audits. I mean, if we can afford to do the wardens, I would give it some thought, but it may mean doing it for several other entities. And the question is, do you have the personnel for that? All right, Member Guy, is there a new question from you or?
Yes, Minister. There are two questions actually.
Okay.
One relates, well, both of them relate to yesterday in the Parliament that we need some clarification. And you were not able to give us because your Chief Medical Officer was not there. And you indicate I do not have the information. One, I find it a little curious, and I need to be advised and guided right now. How do we come to that particular decision? That there were two imported cases. One is a 2-year-old male from St. James. My understanding that we closed our borders on the 25th of March. We are 22 days now into post-closure of the borders. How do we now have an imported case of a 2-year-old?
Okay.
Mo?
Well, I mean, it could arise by different means because we know that okay, so this person came in with somebody, so they actually were picked up through contact tracing of a confirmed case. All right, so it is possible that they could have come in infected and they would have gone through a symptomatic phase. And then now, because what we're recognizing is that sometimes up to 3 weeks in some of our cases, we have cases now that are still not clear of the virus up to 3-4 weeks after. So we do recognize that you can have the time frame for the positive of test can be very variable. We have some people that within 14 days they're clear. I think we have as short as 10 days that persons are clear of the virus, and then we have those cases that are still going on. So that is a possibility. There is a possibility that the child could have come in unaffected and then be infected by the individual who we were tracing. So there is that possibility that that person now could have infected the child at any point during the child could have been exposed at any point and become infected. So there are different ways in which that can be explained, and we at this point we couldn't say exactly which situation could arise.
Why did you opt for an imported case then? Because it seemed more likely, even though we expect and understand that up to 21 days, and you said contact tracing was the basis on which you found that other 2-year-old, that there's a greater likelihood, the odds are more likely that it would have happened here, even though the child came in. Why is it imported?
It's really hard to go on either side of the fence with that. And I don't know all the details of it because we've had other cases before. For example, the case in Corn Piece, where we had 3 of the persons who came from New York with the individual were eventually tested positive. Now, we classified them as imported cases because we believe that they came in with the virus. So it really is difficult for me to say which side of the fence I'm going to jump on. And really and truly, not a guy. I depend on the National Surveillance Unit to make that call as to how they classify the cases. So they would have all the information as to, when they had start of symptoms, what kind of symptoms, was it subclinical? They would have all that information and they would make that decision.
Thank you very much.
I said there were 2, and the other one.
The next one.
Yes. You said that the CMO had, based on her advice, that the Cuban drug, the interferon 2 alpha B, ought not to be used here.
At this time.
At this time, and that the basis for it was just the advice that you were given. Could I get an elaboration on it now, seeing that she's here?
Sure. So I can't, I don't have all the expertise to make all the decisions, and many of the decisions come out of consultation with other other persons who are experts in their own fields. So we do have a clinical working group that comprises anesthesiologists, pulmonologists, internists, pediatrician, critical care specialists, intensivists, emergency room physician, pharmacy, central and field, and standards and regulation. And that is the committee that looks at the treatment options that are out there and look at the literature that is there and make their recommendation. So that's that committee with respect to interferon alpha-2b recombinant being proposed for use. The clinical working group did not accept the drug for the following reasons. One, there was insufficient evidence to support the unreserved use of the drug at this time. Two, the administration of the drug requires nebulization, which is aerosol generating, and thus not recommended for patients suspected or confirmed for COVID-19. It's used for us to have the necessary conditions, including negative pressure rooms, all the necessary PPEs to be using this method, because as you would recognize that even in our emergency departments all across the island, we have moved away from nebulization and are now using the MDIs in order to administer the medication that we treat asthma with. So the utilization of the drug, it required nebulizations, posed a significant challenge, and we thought that we would put quite a few persons at risk by using that. The side effect profile of the drug, as demonstrated in trials with other diseases, included fibromyalgia, diarrhea, depression, and deaths. So based on these, I think that they did take a lot of time to consider it, not a guy. And based on the information that is available at this time, they have made this recommendation that I support.
So member Guy, I'm happy you did the follow-up. I did not have the specific documentation in front of me in Parliament, but as advised, and correctly so, I indicated that I had consulted and gotten the advice of the clinicians, and you have now gotten the specifics of the case. Now, I do not want that to detract from the significance of our collaboration with Cuba, certainly as it relates to our healthcare workers, 140 of whom came into the island recently on this COVID effort, another 300 or so that are around in the country helping us. So we value that commitment, we value that friendship, but at the same time, I think it is appropriate for us through our expert committees to look at any new possible solution. And we took all of the technical matters into consideration and then made a decision based on that. So I just want to say that the collaboration is strong, but in this case, we felt it was not wise to go in that direction. Thank you very much for that.
At
okay,
this time.
can I ask if there are any other business, or I'd like to close this section and ask if there's any other business?
There's one in a minister.
Go ahead.
Any other business? You mean you're going on to the next agenda item?
Yes.
Okay.
The next agenda item meaning any other business?
I have two questions that I wanted answered. But my hand has been up, Minister.
I'm going to raise it on the other. Yes, go ahead, Member Brownberg.
Okay, so just two quick questions. The first one has to do with a comment that I've seen circulating in social media from an individual who says that they worked with Alarica, is at home. No, let me quote it correctly. That the girlfriend works with Alarica, is at home with flu-like symptoms, called the 1-888-1 love number and was told to await a call from the HR. So I just wanted to raise it because I'm not sure if everyone is clear on what the protocol is, what the procedure is for those who are asked to stay home and what to expect. So that is one. I don't know if you would like to comment there.
Well, it's rather unusual for a 1-800 number receiver to say, wait for a call from HR. What would happen in this case is that if the person contacts us, we would want to make arrangements for the sampling to take place for testing, and we would advise them about quarantining themselves and so on. So I, remember, I'm sure you saw it, but as you know, as much as I do, being the position that we represent, not everything on social media we're going to buy into fully. So I would love to, if possible, if you send me the number of that person, I would ensure that follow-up takes place, just to ensure that it's a genuine scenario, and we will follow up.
I'll send it to you, Minister, as you would imagine, that I asked the question, giving you an opportunity to respond, because it is there, and I believe that it is important when we see issues like those to clarify them as quickly as we can, so that persons don't run with what is happening when it is not what is expected to happen. So that was the reason why I brought it to your attention. The second question that I have, I've been concerned about public education, and we have been doing a very good job at it. I just believe that there is still some more transitioning to do in terms of the focus of the public education. And I am concerned now, as we get to another phase of transmission, that a number of individuals in our communities see this dramatic entry and removal of a community, of a neighbor, for example, and they're not sure what is happening, and they're not sure what to do. And I find that it is indeed causing some level of anxiety and panic in the communities. And I am wondering what thought is being given. Is there some kind of a video, public education focus that would say to community members, when you see someone come, they could come for one of 2 or 3 reasons. Here's what we need you to do. There's no reason to panic. And because there's this issue of stigma, I believe it is important to deal with it early and now to see how we can calm our communities and members.
Thank you.
Yeah, that's a very relevant point, and I mean, we see different aspects of that every single day. So Dr. Spence is here from the Health Promotion and Protection Branch, and she's making note of this. It is something that we have started to have discussion about in terms of how it is that we approach the situation. I mean, many of our approaches sometimes are recommended when we make the contact. Persons will tell us, don't come at this time, come at this time. When you come, don't do this, and we try to accommodate persons as much as we can. It's a very dynamic situation. A lot of own community cultures that we have to deal with, but we do recognize it, and I thank you for your input where this is concerned, to again bring it to the fore. And as I said, Dr. Spence is here, and she's making her notes, and to have discussions with our prevention and containment team to see how it is that we try to tidy this up to make persons more compliant.
Okay, thank you. All right, Member Golden, you had a quick question?
Yeah, just 2 little points, Minister. And this is on a broader matter. The care program, which I know is not your responsibility, but I'm raising it here because this is a forum in which we can speak to these things. The care program in relation to persons with disabilities. There are a number of persons with disabilities who do not have TRNs because their disabilities may be such that they're unable to work. The mechanism presently in place doesn't allow their caregivers to apply on their behalf and to receive funds on their behalf. So I'm asking you if you could please just put in a plug for some mechanism being put in place that would allow persons with disabilities to apply and receive the available care grant, which they would normally be able to and would be eligible to apply for, but because of their particular circumstances, they may not.
I'll raise that with the Minister of Finance. I'm actually going to a meeting now where he represents, so I'll raise it with him for sure.
Thank you very much. And the other small point, which is a very big point, relates to water, Minister. The supply of water. What is happening is that unscheduled stoppages of water are prevalent. So communities are not being told you will get water at this hour every day or whatever it is. They just don't get any water for days on end. And there's no published schedule or any communication as to when they will receive water. And this largely seems to affect lower income areas, I must say, and it's part of what I regard as the inequality in our society. At a time like this where hand washing and hygiene are so important, especially with the vulnerabilities of densely populated communities to community spread of the virus. And we heard Dr. Paris Liawayi last time indicating, which all of us expected, which was intuitively known, that these are the communities which have the highest risk. There cannot be a situation where Water Commission is depriving them of water for days on end. They must be entitled to get water, even if it's not 24/7. There must be a supply of water to them every day. We have our, small allocation to deal with trucking of water and so on, which we're going to try and use. But because we're not told what the schedule is or what the position is by Water Commission in relation to the supply of water to these areas, certainly in my constituency, and I'm sure I'm not alone here, it's very difficult to formulate a proposed schedule because you don't know what the Water Commission are really up to. They have not made it clear. So I'm really appealing to you to speak to whoever's in charge of the water portfolio and the head honchos at the Water Commission to be transparent and open as to what their policy is and their operating guidelines currently are in relation to the supply of water on the ground in the inner city areas, and to ensure that they do provide supply every day for a period of time, which is known so people know when they can catch the water.
Thank you very much, Member Golding. And I've made a note of this also, and I'll raise it with the relevant minister and authorities, because it is a part of the high-risk community plan, which you saw last week. So it is factored in the equation around how we protect those communities. All right, can I get
no, Minister, just very, very quickly. I spoke earlier about the congregation at post offices for the same care grant that persons have been applying for. A number of our seniors I've noted do not have a bank account, which means that they're going to be asked now to pick up these checks at remittance locations. And I am just wondering if we could begin to think from now about how we ensure that they are protected and the necessary physical distancing would be applied when that time comes, so that they're not further placed at risk.
Okay, thank you very much. All right, ladies and gentlemen, I wanted to mention.
Chairman,
yes,
I saw my hand up. Quick question.
I thought it was up from the.
No, man, that went down and came up again. It's not the feet that is up, but it's the hand that is up. Right?
All right.
Quick question. When was the group with Professor Bain established by you? Just curious.
Would it be about 4 weeks ago?
Okay.
It was about, I don't remember the exact date, I don't remember, but it's certainly a number of weeks ago. And we had a meeting this week. On that note, though, I want to thank Professor Bain for being on, but the CMO, maybe I don't want to generate too many more questions because we have to close because of another meeting, but CMO wanted to just comment briefly on the antibody test and the plans that we have for that. You wanted to just do that quick, and then we can pick up at the next meeting on it. I'm classifying this under AOB, if you don't mind, colleagues. Go ahead, CMO.
Right. So we recognize and we have entertained all the discussions on antibody tests, and we, as a ministry, we have looked to see how it is that we can in fact utilize antibody testing to enhance our response to this disease. So we have taken note of what is being done in some other countries, while it is that we do maintain that for the detection of disease, the PCR testing is where we are committed to remain until there is sufficient guidance to say to go in another direction. But we recognize the usefulness of antibody diseases in determining past exposure of different communities. So we have looked at, for example, some of the communities that we've had exposure in 3 to 4 weeks ago. And we would want to know what is the effectiveness, what would have been the effectiveness of our measures in containing the disease, what is the level of subclinical disease that is present, and certainly its impact on transmission. And so therefore, as a ministry, we are collaborating with Statin and with the University of the West Indies. We have put together a team. There is, a matter of fact, several teams that are working on different aspects of research, with being coordinated through the ministry and the University of the West Indies. And we have a team that is looking at seroprevalence studies. And so we have decided to take on doing some seroprevalence studies in some of the parishes, for example, say 7 miles, 8 miles, Corn Peace, and in Port Antonio, to look to see what was in fact the level of exposure. We do believe that now, 3 to 4 weeks after the initial case, that certainly we would have antibodies being formed. We, as a ministry, though, we have to be very, very careful how it is that we proceed with this and how it is that we validate the information. And so we're just not willy-nilly going about it. What we are going to be validating the tests that are used with the tests that we have done in terms of validating the kits. And we are also going to be looking at the population on a whole to see, because we know that there's quite a bit of cross-reactivity with the common coronavirus, as well as we don't know the cross-reactivity with other viruses that we would have been exposed to in the past. And so therefore, we are going to use samples of blood that we have stored from years past to run the antibody test once we have validated on those samples to determine whether or not there is what is the level of positive antibody exposure. And so therefore, it means that if we get a 5% exposure rate coming out of this sampling, if it is that we had a 5% exposure rate in 2016, for example, when we had the influenza outbreak, then we know that it would not have been significant. So we are running those kind of comparisons. It's something that I know a lot of persons have been pressuring, but we do have to work out those details in terms of being able to be confident in any kind of result that emanates from this. In addition, because there is no accepted validation right now for the antibody test, we are also going to be collecting a subset of the blood samples for storage so that we can run those whenever there is a validation test that comes around. Okay. So that is what our plans are, and we are moving quickly to do this. As we said, 3 to 4 weeks after is a good time. We have had our meetings with the team from last week. We've had those meetings, and we have already started to do the necessary background work in terms of getting these done, checking the storage of samples, and all of that to be able to proceed.
All right. So thank you, ladies and gentlemen. That was a study defined that is going to take place. Thank you, CMO, for that further elaboration on testing. I really wanted to focus this committee meeting on the testing issue because I know there are concerns. I know the concerns are sincere, and the intent is sincere because, of course, we're all together trying to overcome this challenge that we face. And so I wanted to approach it in a manner that really tries to give the information so that for those of us who are not certain, hopefully additional information will make that happen. Professor Bain has been on and he spoke, and I want to thank him for being on and for contributing. And we're always open for further discussion. I just want to conclude by saying that we will see more tests done. We do feel that what we have done to date is the appropriate approach. And as it relates to antibody testing, the CMO elaborated on that in terms of what will happen in the coming weeks. We can elaborate on that in the next meeting. where we draw from any other business if there's a need for that. But I want to just close by thanking members. I have a cabinet meeting that I have to attend now. Thank you very much for coming on, for participating. This is our second Zoom special select committee meeting of Parliament, and it has gone well, I think. And I want to appreciate your attendance and your contribution. Thank you very
Minister,
much. Yes.
on the motion for adjournment, just quickly, you had promised to look at the pharmacy, the regulations, some temporary, some temporary adjustments to allow for pharmacies to accept prescriptions. And you said it was in the making.
Right. They have started, I'm being told, as I had said. I really
That's last week, Minister.
I know. So let me find out exactly where it's at, and I'll get back to you on it.
Okay, thank you.
Okay. Thank you, members. Motion to adjourn.
Same here.
Okay. By member Guy, seconded by member Golding and member Brownberg. Thank you very much. Have a good day.
Thank you.
You too.
Thank you.
As an inner city youth, I'm a youth if you know my rights. Not because you see me on the corner, you are going to abuse me.
I have a life to live. I deserve to be heard and respected. But know my rights. Know your laws. Know your rights. Respect you.
What happened, Tristan?
Mommy, what is an activist?
Activist? Where you hear that word?
A lady was on the TV and she said she is a children's activist.
Oh, the advocate.
That's what I said.
Okay. The children's advocate is the person who makes sure that people know and respect the rights of children. She also makes sure that they are protected. She makes sure that even the government does its job properly when it comes to kids.
Children have rights too, Mommy?
Of course.
So, Mommy, do I have the rights to a little ice cream?
Right now, you have the right to go to bed.
Be an advocate for children's rights.